Aloha. I hear that you want to know how to interview patients. I'm really glad to hear that because we need more healthcare providers in Hawaii. In fact, before I get distracted, I want to let you know that there is lots of help for you to be a healthcare professional in Hawaii. My name is Dr. Kelley Withy. I'm director of the Hawaii Pacific Basin Area Health Education Center, and we make a promise to help anyone in Hawaii who wants to go into healthcare get there. Just let us know you're interested, and we are there for you every step of the way. That was my advertisement. Now, back to work. How do you define what a patient interview is? That's a tough one. I think of it as a little bit of mystery solving, a little bit of conversation, and a lot bit of conversation. Building trust, getting to know each other. And what I'm going to teach you is that there's no one way to interview patients. We all develop our own style. So don't worry. There is no set amount of time for an interview. There is no set procedure. But consider it the beginning of the intake process, because it is when the patient tells you what they need. Are there questions you have to ask? Yes, there are different questions depending upon your setting and your patient needs. Here's some questions for you to try. You want to know your questions in advance so you can write them down. Before going into the interview, you should have a list of the questions you need answers to and something to write or type with. Then you start with introductions, which is something that you can practice, and it's actually the most important part. First thing you want to do is practice your opening gambit. Everyone gets nervous, so focus on speaking slowly, or your patient may not be able to understand you. Hi, I'm Dr. Withy. What can I do for you today? When I first started, I think I said something like, my name is Kelley and I'm a first-year medical student. I'm going to take your history. Well, I had to slow down. And it sounds a little awkward, doesn't it? It was a long couple sentences. And I don't think I had a big smile. So now you need to practice your greeting because from there it gets easier. Once you are comfortable with yourself and your introduction, the most important thing to do is listen. You can start by asking the patient an open-ended question. Then you just let them talk.
So what were you hoping to talk about today?
So how are you feeling today?
So how have you been since your last visit?
You can take notes while they talk, and you will get better at remembering things. But you should write down things that you don't want to forget to clarify. By letting them talk, you show them respect for their needs and you build trust. But I'm going to tell you something. It's really, really hard to just listen and not break in. I can't actually do it for very long because I want to get all the specifics about what they're telling me. It's hard, but the more you listen, the more you try to understand, the more people will trust you and the better you can help them. And to make sure you understand, you can repeat things back to the patient. The next step is to make sure you get all the information you need from them. Early on, you will always forget something, but you can call them later. Don't worry. We've all been interviewed. So I want you to go back to that experience and remember what you liked and didn't like about when a healthcare provider interviewed you. Because it's really just a way of getting to know someone. You may have uncomfortable situations. I used to always be told, you look too young to be a doctor. It drove me crazy. It would make me kind of mad. But then I thought about it and I would say, well, I look younger than I am, and just smile, and get back to the interview. Now I just wish somebody would say that to me. I remember one of my first patients was a senior citizen who asked me out on a date. That was uncomfortable. But I think what I said was, thank you for the compliment, but it's not allowed. I'm not allowed to date patients. And I just went on with the interview. Let's hear from some other doctors about how they deal with uncomfortable and challenging situations. So we've been talking about difficult situations. So can you tell us about a difficult situation in a patient interview and what you did?
Sure. I think that a common challenge that we find in primary care is patients may come in with a laundry list of concerns, and it can be very challenging to get through all of those in just 15 minutes.
So what do you do?
I think it's important that we come up with a shared agenda at the beginning of the visit. So I'll often ask the patient, what is most important to you that we cover today? And then when they're done, I let them know, that's great. We may not be able to get through all of them. And here are some things that I also wanted to cover today as well.
So do they tend to trust you, or how do you get them to trust you in that and make a plan together?
Well, I think the most important thing is that people feel like they were heard and that they felt cared for. And so making sure that we cover what was most important to them oftentimes accomplishes that, and reminding them that this is a long time relationship. And so if we can't cover everything today, I can certainly see them back in a short time.
Okay, and what if they don't stop talking and you need to leave the room?
That is definitely challenging. I think part of what we learn in medicine is figuring out how to redirect conversations and figuring out how to do that compassionately. And again, I try to come back to that idea of, I really want to make sure that we are taking care of what's most important to you today. So I'm so sorry that I have to bring us back to our agenda item. And you know, they may not be happy, but hopefully they still feel cared for.
And you talked about making a plan together. Can you describe the teamwork?
Sure. As we move into the plan, I share with the patient something that I might propose and ask them what they think about that, and ask them for their ideas. It's really important that it's a plan our patient feels they can accomplish or that they have buy-in to. Otherwise, all we're doing is treating ourselves. Maybe we feel like we've checked all the boxes, we've given them the right medicines, but if they go home and they don't feel able to follow that plan, then the next time we see them, they'll probably be in the same position or maybe even worse.
Right. So we're talking about when you feel uncomfortable in a patient interview. Can you tell us about a time that happened and what you did?
Yes, I have one patient who is very difficult, and frequently in our interactions she gets very upset and sometimes can cry or yell at me and feel that I'm not providing for her at her needs. And so in our first interaction, I asked her what is one thing that we could do to be successful working together as doctor and patient. And she asked for this one particular item. It was a scooter, and we were successful in getting her this new scooter. And as such, whenever she is upset with me or yelling at me or thinking that I'm failing her, I always bring her back to that first visit where we said we would work together, and to remind her of the success that we had in getting her the scooter, which is the most important thing to her at that time.
Another challenging situation you may encounter is if you have patients who speak a different language, or you can't hear them. If you know ahead of time, it's best to have an interpreter that is outside of the family. But if you only have their family members available, they can translate for you as long as the patient gives permission, oral permission, for them to do that. Interpreters are actually different from translators, but that's a lesson for another day. Now that you've got all your information, you've got to wrap up the interview. Here's how I did it when I was starting out. Thanks so much for talking to me today. I'm going to go out and present this information to the attending, and we will be back to see you together soon. You can personalize it as well. There's more to interviewing and building rapport, but that will be for our second lesson. Let's just practice for now, because that's how you get good at interviewing. Practice. So what I say now, much shorter, "Hi, I'm Dr. Withy," What can I do for you today? So why don't you practice what you'll say to a patient? And then we'll talk more.